Okay, David, thanks for coming to our practice. I'm here now really just to show you about emisAccess. emisAccess is the ability for you as a patient to connect to our IT system, which is called emis. But the magic of it is that you can do it anywhere in the comfort of your home using a normal internet connection. emisAccess will allow patients to request repeat medication without having to come to the practice. It will allow them to check, book or even cancel appointments online. It will allow them to send us messages, and it will also even allow in the future for viewing of your records if you want to know a bit more about your results and so forth. So it's got a lot of potential. But I guess the first step is to show how it begins, and that means coming down to our practice. Mm-hmm. So what you would need to do is, Dave, you need to come down to our practice and tell our receptionist, I would like to have access to emisAccess. Just because we're filming this, I'm going to actually show with a dummy patient. But the concept is that the receptionist will then generate you a letter, and it takes them literally a minute to do, so it's very quick. The letter gives you some security details, so you've got to value this piece of paper, because that security details is what we need. It's also going to show you a link to this video, so that you can watch this video if you need help about what to do. So this is a bit strange that we're recording what we're talking about. So the first thing is to go to this website, emisAccess.co.uk, and that's a security website, so it's HTTPS at the front of it, but it's all that on the letter. And the first thing you see is, it says here, on the home page, it says here, press here to create an account. So we're a new user, that's what we need to do. And there's two screens of information. The first screen is this data here, so it's the PIN number, then it's the practice ID number. That identifies us practice from amongst all the practices. Then it's the access ID number, then the NHS number. So that's the first set of data, so we just click on there. Then the second screen is this information. It needs your surname, and it's important just to check that we have got your surname right, because it's going to match up with how it's spelt in our practice on our emis computer system. Okay, and so we put in the date of birth, then we need to choose a password which is at least 7 characters long, a mixture of letters and numbers, and it is case sensitive. And the third piece of information is a security question. They won't ask that all the time, but it's just in case, and it gives you some suggestions of questions and you can obviously pick your answer.
Not just your mother's maiden name.
Yeah, and that's it. So we click submit, and it's going to tell us your sign up has been successful, and we can now use the service. So let's just have a look at it now. So now that we're registered, we would go back to the emisAccess homepage, and all we need to do is remember two pieces of information: the practice ID, the access ID. So once you've registered, the aim is to destroy this letter, but try to keep those two pieces of information handy.
Yeah. I mean, we're all sensitive about identity theft, but even more so if it's medical, medical records, etc. And I agree with you. But once you've got in there, just put it somewhere safe, but throw away any pieces of paper.
Yeah.
Shred it.
Yeah.
Yeah.
And so we then sign in using that details, and it gives you the options. So for example, here it says appointments. We don't have any appointments booked.
Right.
Here it shows repeat prescriptions. You can put make a request, see requests that you've done. So this patient has already requested some paracetamol recently, but if you click here, you can see a list of all the repeat medicines. So it's also safer, because if you're requesting things, there's no ambiguity. You can just tick the ones you want.
Yeah.
So you click on the dots of the medication you want, and if you want to put a message to us, you type it in there and you press make request, and it's instant, so it saves you a trip. And there's other functionality here. If you look here, it gives you the option to change your password, view your contact information if you need to tell us about a potential move, send messages, and potentially there could be more functionality. So that's it in a nutshell.
Right. With the prescriptions, you're doing the prescriptions, it's being authorised electronically by the doctors here.
Yes.
Now we have a system whereby we can have prescriptions sent to the local chemist.
Yes.
Is it possible to send it electronically to the chemist?
That's probably a future development.
Okay.
At the moment, what would happen is request comes in and we actually generate it as a paper prescription like normal. But
Right.
but it's likely in the future that what you're suggesting will probably happen.
And as now, I guess the chemist will pick them up.
Yeah,
as
the
he does
chemist
now.
picks them up
I see.
and takes them
Okay.
away. So that's how the prescription functionality
Okay.
works. So the main difference is that it's quick, it's instant from your home to the doctor's inbox, and they can action it, so you could save a bit of time with that, and it's also more accurate because we know exactly what you've wanted.
But I'm thinking from a fraud point of view that at least if the prescription is signed, it's going to be checked manually.
Yes.
Rather than just being squirted through without
it doesn't
any
go. Yeah, there's
manual intervention.
Yeah, there's steps in the system.
There's checks and checks and balances.
Yeah, so it's just the same checks we would do if you dropped in a request by paper into our box.
Right.
Request message. It's exactly the same process after that. A couple of other things. There's always a chance you'll forget your password. If you do forget your password or forget any of your details, you just need to come to our practice, tell reception, they'll reset everything and generate you a new letter, and you'll have to just repeat that whole process of re-registering. Really the main thing is, until you've actually registered, this piece of paper has all your details. So once you've registered, the piece of paper is not important.
That extra question you were asked for, the extra security question, what's your favourite actor?
Yeah.
Would that be used if, say, you've forgotten your password? You would say to the system, I've forgotten my password, and they would then go to the security system.
Yeah, Email Access does use that as a backup question in certain situations,
okay.
so you might be prompted, but it's not one of the common questions. So for the login function, you didn't need to remember it. So it's a bit like online banking, where it's one of those backup security questions.
Right. So if I forgot a password, I couldn't actually go into the system, and by answering this extra security, it tell me.
At the moment, no, you can't.
Right. Okay.
You can't.
Okay. Fine. It's, yeah.
So it's built to be even more secure at the moment.
It's even more.
Yeah.
I'm happier about that
Yeah.
because if someone would just go into into the system, and who happens to know what my mother's maiden name is or whatever, they would just easily get in there and get my password.
Yeah, and in fact, if you have questions about privacy, if you go to the homepage of Email Access, there's this box here you can tick, and it gives all the information about privacy, terms of use. So this is really part of our system, which has been around for several years. And if you have any queries, there's a lot of information on there.
Great.
Okay,
Great. Looking forward to using it.
good. Tell us how it goes.
I will.